challenges specific to healthcare, and we have made some dedicated investments in products that take advantage of our infrastructure, and in some cases the infrastructure that you own, and have crafted solutions that work on delivering value from our expertise as a provider of real-time communications. And we look at the pre-admission process, working on the patient flow in the hospital, improving the care of patients, and also post-discharge follow-up. In today's healthcare environment, I'm telling you this, you already know all this, but you know, there's a rising cost of services, and yet there's a demand for improving quality and using resources in an effective manner. So you're really focusing on doing more with less, as we all are in IT and in our business and in your employers in the healthcare setting. There's all sorts of changes that are happening, federal mandates and regulations, how to do integration with a variety of the many applications that are used in healthcare, and how to consider privacy of the patients. So what Avaya has done is we've used and leveraged our expertise as a provider of communications, and we focus on how to work on improving preparedness in pre-admission. So think from getting a patient into your door to discharge and follow-up. So from door to discharge and follow-up, we've figured out ways that we can add value. Reducing manual things and working on improving admission, working on improving care with delivering of alarms and alerts to mobile platforms, and giving you options in which mobile platforms you would like to use, and then post-discharge follow-up and streamlining that, as you're going to be judged from a point of view of your Medicare reimbursements and other type reimbursements on quality, and whether you can improve on preventable readmissions and things like that. Our post-discharge solution will help in that area. And so we automate these things, and we use our expertise as a provider of real-time communications, and we use our solutions to help have closing the loop in these communications, so that an IVR-type machine can do this. In integrated voice and response technology can help do this. And we consider your investment in your healthcare information system infrastructure. Why would you work with us? Well, we're very stable now, and have been all along. We've just restructured our bonds and our financing, so we have a very good long-term outlook, and we're preparing our company for initial public offering. But we focus in healthcare. We have these investments, and we think they're very innovative. We pull together a variety of expertise to improve your processes and make your clinical staff's life easier, and making sure that the resources, the right resources, can get information in the correct time. And we're a fit-for-purpose company. We focus on unified communications and contact center technology, and we're number one in both UC and CC. So we're number one in the markets that we serve. In the case of healthcare, we have a large installed client base. In the case of Illinois itself, in the Chicagoland area, we have many customers, as does Maron Structured Technologies, and that client base is growing from the largest and most famous hospitals in the world, like the Cleveland Clinic, the Mayo Clinic, Johns Hopkins Hospital, down to small regional hospitals like Glencoe Regional Medical Center, a 35-bed hospital in rural Minnesota. But we have solutions that run from the largest institutions down to a small regional clinic to make things work. In this case, we focus on pre-admission preparedness. So we have a proactive outreach, and we have publicly announced references. We just finished the HIMSS show in Orlando, Florida, and our first customer came from the United Kingdom, And in that case, we actually integrated into a Cisco, our competitor's call manager to make this solution work. There's a lot of revenue lost and inefficient use of time with people that don't keep their appointments, and also they're ill-prepared for the appointment that they're supposed to have. So by ill-prepared, I mean whatever instructions they were supposed to follow to keep their appointment, they've forgotten. And that amounts to not a good use of the hospital staff and resources. I'll give you two quick examples. One would be someone who was supposed to come in for the test to see if they were diabetic, and they're supposed to fast, and then they get their glucose tolerance test, and they don't prepare correctly, and they kind of the appointment's a waste, and they have to come back. The next example would be in MRIs. If you know in advance that your little 20-minute or 25-minute exam, you're going to be late or not show, I'm not sure what they charge in the Chicagoland area for the MRIs, but let's say it's $700 or $800, you would have a chance with these solutions to backfill and not lose that revenue and have your costly resource in an MRI machine stand idle. The most glaring example we were given by a customer was actually in Parkland Hospital in Dallas, Texas, where they had an extreme example of how they thought this solution would be applicable, where this one lady was given her preparatory instructions for orthopedic surgery, getting 2 pins and a plate in her ankle. And she had told the hospital that she had not eaten anything, and they were getting her prepped for her operation. And then she was interviewed finally again by the anesthesiologist before he had completely prepped her for surgery. And during his interview, he found out that she actually had 8 cinnamon Tic Tacs. Now, 8 cinnamon Tic Tacs might sound like a lot to eat, not many calories, not whatever, but the point is in the morning she had those 8 cinnamon Tic Tacs, and it generated gastric juices and saliva, and she was going to be intubated. So because of that, she could not go and go through that operation. It would be too risky. So what you had was a time to go ahead and they had to have the time of a hospital team that's there for surgery, 2 orthopedic surgeons and an anesthesiologist, as well as the nursing crew that was there in the operating room, and a surgical technician basically had to wait while the next appointment or the next surgery scheduled had to be prepped, hurried in advance. So you have this very high dollar team standing and waiting. So our solution here, and this is a long-winded example, but the solution is the appointment reminder, and it reminds people of their obligation. You know, hey, you made this appointment, and secondly, did you need to be prepared for this appointment? What we do is we integrate in with your. We have a good ROI for this solution. We integrate in with either a flat file, as in the case of the UK, or in the US, we have a customer, William Beaumont Hospital, that's our public reference, and we integrate into their Epic enterprise. It's called a Cadence enterprise-wide scheduling system, and we download all their appointments in real time. And based on the rules that you set up, like when to contact the person, what information to deliver based on what procedure, we go ahead and do this with an automatic fashion. The reminder calls will dial out from our solution, which is software-based, through a SIP trunk in your PBX, and then dial out either via PRI or whatever means to the public network and communicate with your customer. We can also send an SMS message if you get a gateway provider. That costs about 3 cents for each message. But we have these solutions have taken hold, and we're very busy. We do multiple languages. We had one request in Chicagoland for budgetary, I think, for English, Spanish, and Polish. So we can do reminders and text-to-speech, deliver messages, and it can be either South American Spanish, European Spanish, Central American Spanish, that type of thing. We have good ROI for this solution. Down, the smallest hospital customer we have is 100 beds. The largest is where we're putting this in is 3 hospitals over 800 beds each. Now we have other solutions to optimize the flow of the patients within the hospital. We have the appointment, the admit coordinator, and also the discharge coordinator. And the way this would work is once someone lands in the emergency room, any task that requires human latency and the interaction between 2 people, the software goes out and it lays out a variety of tasks that we code in based on your business rules and contacts the people. It would put the primary care physician in communication with the hospitalist or the emergency room doctor. If you need a specialist, it would look up in your insurance and see which specialist it takes this insurance in your hospital or clinic and would be able to treat that patient and brings them on board. And then for the discharge procedure, it would help the nurse quarterback all the tasks that are needed to discharge patients from hospitals. So with our workflow solutions, you have to think that we're moving the patient is like a little moving on a chessboard or whatever. We're moving the patient through all the various stations in your hospital and integrating our solution into the backside of your of all your HIS systems so that you can get to a quicker path to revenue. In the case of discharge, if you can get people out of your hospital in a faster fashion, it's to the hospital or the clinic's advantage, because based on the diagnostic codes of a patient, that determines how many days of stay that they're allowed to have. So if a hospital can't discharge a person fast enough, quick enough, that will affect their Medicare reimbursements and also Medicaid. So you're wanting to get people out of the hospital quickly and turn the room over quickly and have it ready in a state where the bed can be used by someone else. Good return on the admission coordinator. We really focus on eliminating or you're left without being seen statistics in the ER. Typically, all the people here in IT, we're all type A personalities. I'm sure if you met Heather, you would know she was a type A personality. And we're impatient type people, and we're employed. You don't want the people who are employed and have good jobs and good insurance kind of getting upset because it's taking so long and leaving your premise. And you also don't want to have necessarily ambulance diversions because your emergency room is full and you can't take on new people, so then they go to some other place closer by. We get people through the emergency room and into a bed quicker with these solutions. When we talk about improving patient care, we talk about our little device checkout solution. This helps with your mobility, and it integrates in with your PBX, either in Avaya Communication Manager or on the Avaya Blue side, a CS1000 product, and it would help improve your mobility. It allows each one of your staff to have a virtual phone number, so you could have you may only need 200 actual mobile phones in your hospital or your place of business, but you may have 1,000 people on your staff in a 24/7 place. So you would only need to get licensed for the 200 things, but yet you could virtually assign directory numbers and directory properties to each one of your staff. Why is that important? Because this way the nurse, you always know how to communicate with the nurse, and also we have something called role-based checkout. So another part of the hospital needs to communicate with a nurse. They may not know which particular nurse is working, and they may not know the phone number for that particular nurse or staff, but they will know that there's a charge nurse, they will know that there's an L&D nurse, they will know there's an ER doc, things like that, and we can assign based on role a phone number based on role. So you, in a 4x7 place, you can have a general phone number for a person, so they can simultaneously have an extension of 1111 to call them personally, or if someplace, the lab, the pharmacy, the emergency room, someone else needs to call, say the labor and delivery or postpartum unit or intensive care, there might be a role-based number for intensive care, and that could be just 4,000 as the extension. So you can communicate with that person that way. And also the charge nurse or the department manager can be communicated with via role. We have, again, a good ROI for this. We've seen people receive very good paybacks. What you're doing is you're getting less phones. You're spending less on licensing. You're spending a little more with us for this solution, and we can work with companies such as like a middleware for alarming vendors like a Globestar Connexall or an Amcom or maybe even an Emergent, although they've been a bit of a challenge since they got acquired by Philips, and go ahead and integrate so you can have a single sign-on type of thing where you sign on with our barcode scanner. We can read a badge reader like you would scan a credit card or an HID reader, get the person's information, scan the phone itself, and then go ahead and reassign the phone number of the mobile device. Last, we're getting towards the end here, which is the patient discharge follow-up. This is also a very critical area. We actually have gotten the requirements from this solution from the Mayo Clinic, and what they do is they use this for following up on patients who have been discharged that have a high probability of a readmission. So their view is they want to take care of these people kind of while they're at home and keep in contact with them through an integrated voice response system that will call them and get information about them, like if they had a fever, are they taking their medicine, and a series of questions if they're following their post-discharge instructions. And hospitals use this to manage patients in a certain population range. So it would be type 2 diabetics or diabetics in general, 1 or 2. People that suffer from depression, there's a score that they keep when they ask 9 questions, and I want to say it's called a PQ9 score, and then based on the score, it rates their severity of their symptoms. And what we have is we integrate with the contact center and ask a nurse, and if the questions are out of a certain range, it directly connects them to a psychiatric nurse so they can be talk to a person if you've hit an out of bounds condition. And also they use it for the blood thinner clinics. So someone that needs followed up when they get a new medication, in the case of the blood stroke clinics and blood thinner meds, it's called warfarin and Coumadin, and the meds have to be, you don't take the same dose of medication each day. You may take a certain level of the med one day, you test the viscosity of your blood. The next day, the medication could be more or less. You may skip a day or skip 2 days, but that's all tightly regulated within the first several months that they get people on these blood thinner medications, and it's a very strong relationship between a nurse practitioner and the people in this clinic. So if the people that are okay can be communicated with this follow-up application, then we'll go ahead and use this. Once again, an IVR application. Why? Well, we want to focus on those high-risk patients. We want to also give them a chance to get satisfaction. The hospital cares about them, is looking to take care of them, and reach out in the community and do a preemptive type outbound contact. And we have intelligence for each thing. You can schedule as many different procedures and follow-ups as you want. It's not just calling you up and how are you doing, but you can ask very specific and targeted questions based on your the discharge. We integrate in several ways. One would be through a flat file with your patients and the type of information that they have given us, or the other would be directly with your healthcare information system. We can integrate with your admit, discharge, and transfer program, understand what the discharge is by intercepting the message, and then knowing that if someone just got surgery or someone was just discharged for congestive heart failure, there might be 10 or 12 different scripts that you have that you really want to focus on better management of those, of certain populations, and we can codify some scripts to ask people questions and get responses, and then based on the responses, either A, coach the person to try this, connect the person to a nurse, or do some other sort of action. Very good ROI on this. We have a lot of interest in this solution, and as I said, we're getting a lot of the requirements from the Mayo Clinic in Rochester, Minnesota. You have an architecture and an investment in Avaya, and we're leveraging that investment, and we want you to know that from a healthcare perspective, our goal is to make sure that we can connect your people with your processes and your systems to improve patient care. So I'm sure that you've seen and been introduced to the topic of our session manager and our expertise in unified communications. Well, these solutions will go ahead and extend that investment that you have, as well as your investment with your healthcare information system, which I know you spend way more with those companies than you do with us on your infrastructure, and we take advantage of that and have included in these applications I've mentioned. Every one of them we have what's called an HL7 protocol stack, so we can decode the messages from the scheduling system and the admit, discharge, and transfer system, and do process events based on what we decode. We can improve our discharge time. We've increased the throughput. We can optimize your revenue by making sure we eliminate no-shows. We have a small hospital in Michigan, basically just for their MRIs, their nuclear medicines, believe it or not, their sleep clinic, and there was one other appointment. Just those little 4 appointments, they believe that they're in the process of really improving their revenue just on eliminating no-shows for those things. We can help with nurses, with communications. Now, some of this is we had a tracking solution with asset tracking, RTLS type solution. We are phasing that out of the portfolio. Why would Avaya do these things? And first, to better serve their customers, and we are a fit-for-purpose company, but we also recognize that there are drastic changes going on in this marketplace, and specifically the American Recovery and Restoration Act. Money has been really allocated into this field to update all the information technologies, and we have customers that have actually refreshed and bought our data products and some of these other products just because they actually call it the Obama Project, 1 or 2 of them, to guarantee certain levels of service and to meet the meaningful use criteria that are contained in the healthcare information technologies part of the ARRA. So Avaya and also our partner. So let's talk about our partner. Our partner is very strong in their neck of the woods, and I'll pat them on the back. They have very much expertise in deploying solutions in your area, and a very strong support organization and feet on the ground to take care of your needs. From a Avaya perspective, when our partner Maron can't do the lifting, well, we have a whole organization of professional service people that will turnkey deploy these solutions that are newer and support them on an ongoing basis. And we have a dedicated people doing research in these areas in our emerging products and technologies group, and we're looking at new things all the time, and we're always looking for somebody to be a beta site and for a variety of technologies, and we provide a substantial discount for people that would be a beta site for some of these newer things. and also if you're willing to be a reference. But we're building up a portfolio of references for all these communication platforms, and you know, you can be confident that we're number one and fit for purpose in unified communications, telephony, and contact centers. And we're making investments specifically to your industry to tie all that together to better address your needs. I'm really at the end here. If there's any questions, I'd be happy to address them. So you can use the chat, and we can take questions as we need to go here. Anything at all?
No, I just wanted to take the time to thank you, though, Bruce. Good morning, everyone. This is Heather Alejo from Maron Structure Technologies, and I am the Healthcare Practice Director at Maron. Bruce, that was a great presentation. I hope that everyone got a lot out of it. Bruce, I actually did just see him down at HIMSS last week, and there's quite a bit that Avaya is rolling out specifically to the healthcare market. And a lot of these applications that we talked about today, Readmissions, Preparedness, optimized workflow, patient care applications, and post-discharge follow-up, are all part of the pie that you should all be focusing on, because these are the applications that actually do show much benefit to your organization. A lot of the people we've been meeting with are no longer just upgrading their Avaya to upgrade their Avaya. They need to show true ROI and show in a healthcare environment especially how it's going to benefit their clinicians, their physicians, the communication with their patients. And I thank you, Bruce, for kind of pointing out some of these specific applications that help organizations do that. Our goal at Maron is just to reach out to you individually and see if we can develop a customized roadmap for you to get you to take advantage of these applications and see what it'll take for you and your infrastructure to build that out. So again, Avaya is supporting us immensely with with trying to get some new customers to be a demo for these applications. And again, this is singly probably the most important things that are driving infrastructure change that we see. And I just want to thank Bruce again for his time this morning. This presentation will be recorded, so we will get that out to anyone on here that wants to share this information with their team. So thank you.
And I would like to thank you for the opportunity also. Thank you very much.
Okay, thanks everyone for joining. I'll be sending follow-up emails with the presentation and contact information in case you have any questions. Thanks. Have a great day.